Hello, good morning, good afternoon, good evening, wherever you're tuning in from. We're live with the very first episode of Healthcare and AI.
Yeah, I'm excited. It's been a long time coming, but it's great to share a stage with you again.
Dr. Giles Morrison, I I enjoy talking to you. I enjoy learning from you, and I've derived tremendous benefits from being able to engage with you. So I'm excited to also create this platform and invite people to talk about the very exciting work that they're doing in the intersection of healthcare and AI. I think perhaps we can start off by talking a little bit about ourselves, just to
Hmm.
give the audience some context behind why we're credible, what we're doing, where our interest lies, and what we're hoping to accomplish.
Yeah, I think that's a great segue. But I have to give you your dues as well. What you've been doing with these podcasts, with the Swarm community, I'm really impressed, and I'm proud to know you, and I'm proud to share this stage with you. But yeah, some intros then for our listeners. So I'm Dr. Giles Morrison. I work as a clinical UX strategist. I've been in this field now for 10 years. Prior to that, I used to work as a medical doctor. And then I took a leap of faith to go into digital health and what I've coined as clinical UX, which is really that focus of user experience in healthcare with a particular focus on the experiences that clinicians and patients have with healthcare technology and services. So I get busy with digital therapeutics, with healthcare behavior change, human factors ergonomics within healthcare environments, but also looking at what is it about what makes people unique that can either help them get healthy or hinder them from the health that they deserve. And I love this sort of work. It gets me out of bed, it gets me excited. And it's a great way of being able to make the world a better place in my own way.
I appreciate you uncovering and breaking down the sometimes taboo areas of inclusivity when it deals
Mhm.
with all these different elements, race, in particular. It's
Yeah,
something that people don't want to talk about, but it's a very big element in healthcare, and
that's
all
right.
the data sets that we use, are not always derived and representative of the people that they treat.
That's
So,
right.
let me give a little bit of intro on myself. I
Mhm.
appreciate you for giving me a little pat in the back there. My name is Joaquin, and I'm the founder of the Swarm community. Swarm stands for Sentient Wisdom and Artificial Reasoning Machines. And the premise is to gather people together that are active participants in the world. They want to create a better future leveraging AI technologies. So there's a lot of themes that we try to bring into the platform: AI for good, responsible adoption of AI, and we try to showcase as much real world practice, lessons learned as possible. Also through the podcast, before we entered into this healthcare and AI subsegment, I was doing a very broad approach and innocent exploration into different AI technologies and different domains that they're applied to. So I think that should be enough to contextualize what it is that we're doing. Perhaps we can kick it off and talk a little bit about, what is healthcare? Hello?
It
Oh,
would help if I wasn't muted.
maybe we're experiencing a little bit of a lag.
No, I think I'm back now. So, I think
Yeah, so maybe we can contextualize what it means to be in the space of healthcare.
mhm. So the topic of healthcare, it's very easy for us to take for granted, assume that we fully understand it, because we tend to just boil down healthcare as that institution, whether it's a hospital or pharmacy that you go to when you're sick. But so much of our life is influencing and governs our health, our interaction with people, the food we eat, the environments that we live in, the work that we do, the diseases that we inherit, as well as the diseases that we acquire. And everything that we do that's understood as modern science to try and deal with ill health once it's really its ugly head. So someone has got cancer, you have, the chemotherapy, the radiotherapy, the surgery, or unfortunately the terminal diagnosis, and you're having palliative care. But all of that is considered part of what's delivered with healthcare. And that's what makes the work that I do particularly interesting, is that I don't just look at how medications or surgical procedures or just telling someone to exercise a bit more, that in itself is not enough to ensure that someone's healthy. I still remember, there's many stories I can think of working as a doctor, but I can still remember you will have a patient who is deemed fit for discharge. So whatever was the issue that they came into hospital with, we've dealt with that. But there's so many other issues that they have that we simply cannot fix. Like, we can't change the fact that there's damp in their house. We can't change the fact that they have to climb 4 or 5 flights of stairs to get into a bed for them to then rest. And there's so much promise about AI solving so many problems in healthcare, but there's fundamental issues like that AI will simply never be able to solve. And so when we think about healthcare really holistically, we have to recognize that AI is part of the equation. It's a tool rather than a solution in and of itself to solve the problems that we have in healthcare.
Yeah, let me piggyback on that. I mean, in our outline of things that we want to discuss, I mean, the very first point is healthcare is hard.
Yeah.
Maybe not in isolation, maybe we can acknowledge that there are a lot of good people that go
Mhm.
into the medical practices to really take people by the hand and guide them through a better
Mhm.
tomorrow, through diet, through diagnosis, through rehabilitation, monitoring. There's a decency and there's a altruistic element to the healing practice,
Mhm.
but that's only the one layer of intent and the actors involved
Yep.
within the system. But that system is existing in a matrix of different other layers and variables. We have social variables. We have economic variables. Not everybody can afford to get healthcare if
Yep.
it's prohibitively expensive. Some people die because they don't have the means to go and get regular checkups, and they get malignant tumors, and
Yep.
before they know it, they are eradicated by a tumor. There are political factors.
Mhm.
Is something deemed appropriate or not? Like, can you get treatment for a specific thing that affects your gender, your age, etc. um, there's racial factors, as we discussed earlier. um, People don't want to acknowledge that we have different biological needs according to the kind of race that you come from. We've been, yeah, we're all human. Yeah, we all have beating hearts and two lungs, two legs, two arms, two eyes. But there are subtle nuances in how our bodies process chemicals,
Mhm.
process pain, ingest different and metabolize different food groups. So it's important to pay a very key a very key level of focus to those kinds of things as well. And then there's the ethno-cultural. I mean, Dr. Giles and I, we're Black and Latino men, and when you go into these kinds of cultures, unfortunately, sometimes there are food groups or elements that are not particularly healthy. They
Mhm.
might be delicious, but they might also be detrimental. Systemically detrimental.
Yeah.
So uh, I don't know what do you say, Giles?
Well, I wanted to pick up on what you said about basically how complicated the variety is amongst humans ultimately. There's just so many different variables that make people different. Because even if you were to just isolate people based on ethnicity, then their gender, maybe throw in religion as well, and then which country they actually were born and raised in for multiple generations, you'll still see that that specific population has got variation. That's normal. And this is one of the opportunities for AI if we move the conversation along, when we think about the good that AI can do, that whole opportunity of precision medicine by really understanding the unique genetic makeup of an individual and how that genes presents itself in a physical way. So I liken this to the situation of my wife's self. So my wife, she lives with sickle cell anemia. And if I'm honest, she's probably the healthiest person I know that lives with sickle cell. I'm used to people being in hospital multiple times a year, if not every month. Like there's particularly women that have sickle cell, they will be in hospital coinciding with their menstrual cycle. It's that deep. And I look at my wife, and she's had some bad episodes with health, but actually, she's been able to be generally quite healthy and not needed to go to hospital more frequently than maybe once every couple of years. It's only been more frequent as we've been blessed with children, and there can be some complications in the end state of pregnancy. Now, all that to say is that AI has the ability to then say, well, how comes Charles' wife is not getting so sick, but this other patient is? What is it about the genes and how that's expressed in a physical way that leads to her being healthier? And just science before the AI can explain that, but it's normally through AI benefits of us seeing, well, what does that then look like as new treatments, not just for Vanetta, that's my wife's name, but for everybody who has sickle cell, or those who could be at risk of having sickle cell in the future who are not even born yet. And that's where I get excited about AI, because actually you're talking about, it's not really a term used these days, but big data analysis. You just got a huge data set of so many variables, so many different touch points, then it's quickly analyzed, and then an outcome, a suggestion, some sort of output is then provided from that. And precision medicine, providing a really laser focused treatment of some kind, is where I see AI coming in. And it leads as well to other opportunities, just how we diagnose and how we then predict disease, not just providing the treatment. And it's looking at how resources are being utilized at a population health, be it on a local level, national level, and definitely a global level. How we can be using this data that we're collecting on people to actually make a difference. So I see AI has opportunity there, and there are companies already working in this space, which is great to see as well.
I like that example that you're weaving here. It's very close to home, and it
Hmm.
affects many different people in many different ways. But I think there's some elements that I would like to pick at.
Hmm.
Genetics. We all have a biological lottery ticket in our
Yeah,
DNA strands. You
yeah,
don't know what you're gonna get, and your parents have some sort of bartering system when they're conceiving you.
yeah.
So it's a wild card that comes out when you're born, and unfortunately and fortunately you get benefits as well
Mhm,
as cautionary elements at play that make you predisposed to be diabetic or
mhm,
have loss of iron or not be able to process oxygen through your blood effectively, or you're
mhm,
going to grow to a certain size. We've been very good at mapping some of these genes.
mhm,
We've been good at collecting data sets on different populations through different clinical studies and the development of drugs. And even just for federal governments and local governments that want to understand how can we keep our population healthy? Are
yeah,
there any sort of inputs that are making people obese, making people become diabetic, making people
mm,
succumb to alcoholism?
yeah,
This plays a a role in the much larger fabric of society, right?
mhm,
Um, so, like you said, we have all this data, and there are all these AI technologies, whether it's natural language processing, like
mm,
capturing doctor notes and textual documents discussing medical theory. There's machine learning for processing vast amounts of data to find patterns that are otherwise uh, not conceivable by the human mind because it's in a
mhm,
format that we can't process or in a volume we can't process. You have
mm,
computer vision or ways of evaluating imagery to find what is the likelihood of somebody having some sign that you may potentially
yeah,
have cancer, or whether that cancer is going to progress at a passive rate or a very aggressive rate. There are a multitude of tools that are in the statistical AI side and the symbolic AI side that we're just beginning to crack open. And that there's that keyword governance, right?
Mm,
Because this affects lives. So in the responsible adoption of these technologies, there's a lot of companies that live and die before they're able to fully be adopted into this kind of system,
mhm.
because you have to pass so many regulations. You have
Yeah.
to you have to be accepted by these governing bodies that impact the population health. I mean, how would you feel if you go to the doctor and well, if I went to the doctor and they said, Joaquin, you're the bill of health, go home and suck on this lollipop. And little do I know that they didn't diagnose my cancer properly because they don't have a data set on Latino men of 30 years old. That would
Mhm.
be pretty messed up. Would I
Yeah.
be able to sue them? Would I be able to get some financial compensation? Why do I care? I'm dying of cancer, you know? That's horrific. They could have told me that if they would have had the proper calibrated instruments.
Mhm.
But you know,
This is one of the problems with AI, and we'll go into more detail about some of the darker side, or at least the areas where it can be a cause for concern. Is that digital health in general? Because this has been my field for 10 years now. Digital health in general is a bit of a wild west. Like, as much as there's a science at play because it's healthcare, and there's a science at play because it's computer science, it's this IT work, there's still a lot of, ultimately, how do we make big money from big business out of all of this? Because healthcare as a service is not altruism, unless it's, Medicine Sans Frontiers, or something else that really is charitable endeavors. Generally speaking, healthcare service delivery is a for-profit initiative. And so when that goes into the digital health space, people are like, oh, how can I make money? How can I make money? Normally, the easiest way to make money from healthcare is if you're doing digital health, that is you're selling a solution, one-off payment, subscription model, but you're paying for a service, and your users are people who probably are either extremely dependent on it because they're very sick, or because they feel competent enough and confident enough to use modern technology to manage their health, which, generally speaking, and it's a very broad generalization, but generally, people who are most confident with computers tend to earn a bit more money, be a bit more educated, and coincidentally, are a bit healthier. And so you start to see this pattern that digital health solutions, which AI would be a part of, tends to target people who are generally better off in life. Whether you see that from a lens of race, or gender, the still common denominator with it is really wealth. Because if you've got enough money, whether the country you live in has got it as to provide public services, or you as an individual allowing you to have access to good healthcare services, access to education, then you're more likely to feel confident to use your phone other than to make phone calls or respond to a WhatsApp message. You use a computer other than, just to browse on Google. You're actually using it for your day job, 9 to 5, in intense ways. And it's those populations that are supposed to be the ones that are using digital health because they're more reliable to pay, but they're not the ones with the greatest need. And one of the reasons as well why that group could be targeted is because the fact that they are a little healthier, they may not need a digital health solution that is providing treatment, which means it's then not a medical device. So, for those listening, you're not too familiar with it, it's very complicated. So, I won't go through all of it. But broadly speaking, if you're providing a digital solution or a physical device that can assess for disease or predict it, that can diagnose or directly provide treatment, you've got a medical device. And a lot of these apps, which are like wellness apps that just give general advice and guidance that's publicly available, even if it's tracking your sleep and your diet and stuff like that, the advice is derived from generally available information. It's not a medical device, it's not regulated. And that's the bit. When you've got digital solutions, including AI powered solutions that are not regulated, this is where we give rise to that whole Wild West situation where anything goes because there is no laws normally at play because someone can choose to pay for something that's not being regulated. If there's a problem, that's on them. And this is, I think, part of the problem that we have with AI, which is a wider issue in digital health, as I mentioned, is that it can do great things. But if it's being done in an environment that's not regulated, it can lead to the worst of outcomes. Literally, people being harmed, if not dying, through interacting through digital solutions. And so that's one of the big concerns that I have is that as much as there's so much opportunity for decision support, like literally taking in all this data about the patient in this moment of time. Like we looked at the blood tests, we've done some x-rays, some other scans, we've spoken to the patient, we've looked at their medical history today, but we've looked at all the records over their lifetime, their parents' records, their siblings' records, the records of patients who live near them, who have a similar makeup to them, same gender, same ethnicity, same age or similar age, all these data points to then say, actually, we know what's wrong with this patient. And then this is a recommendation of what to do. So this suddenly is a medical device, because remember, it's making a diagnosis, it's suggesting what to do as treatment. This is something that's going to be regulated. But when that works, and you've optimized the treatment for the patient and not relying on an infallible doctor, because doctors, I put my hand up as a doctor myself, we make mistakes. And an AI can empower that doctor to make a better decision. This is very, very powerful, but it's in a regulated environment where I will be more likely to trust it. It's where it could just be put in this app to say, oh, we'll analyze what you're saying and then diagnose or suggest that you might be depressed and give you some other videos to watch to make you feel better. But it's not a formal diagnosis because we're not a medical device. And then people rush to it because they only charged, £5.99, dollars, whatever you like, per month. So it's not that high a cost. People use it and then they get misdiagnosed because it's not a formal diagnosis, or they're put into a false sense of security, and then suddenly these people aren't getting any healthier. This stuff is where there's cause of concern for me.
Thank you for painting that gray area. I mean, I want to, I always come from the perspective of responsible adoption,
Mm.
but adoption is sort of running parallel to innovation and
Yes.
experimentation
Mhm.
and creating opportunities within bounded context to learn how to do better or try new things. I personally find it to be incredibly interesting that it took as long as it did to democratize access to personal data collection devices like the Fitbit or
Mhm.
other things like it that monitor your oxygen levels. They monitor your sleep patterns, your heart rate,
Mhm.
your other biometric features, how warm you are. That's really cool. And that's what's going to leave us to have access to our own data sets and be able to cultivate some more regimented, scientifically driven, evidence based, personalized treatment plans. So
Mhm.
I find that to be a very exciting area that I think we should explore as well. Um, but rightly so, as you said, it's a gray area. It's the wild, wild west. If people are shortcutting responsible solutions in favor of shorter iterative life cycles to get closer to commercial success, if they're looking to extract maximum profit from individuals, maybe they're just giving you crap from Wikipedia that hasn't been vetted or hasn't been tailored. Yeah, information for information's sake is great, and there's a chicken and an egg problem. Like, how can an individual ask for help or seek for more resources if they don't know anything about a subject matter to begin with?
Correct.
So I see the value and the utility of a ramping up period of a solution that's clearly defined that provides an educational transformation in an individual. Here's how you conduct fitness. Here's how you adopt a healthy lifestyle. good foods, bad foods, long-term impacts. From there, that's where we should figure out how to take advantage of these very potent tools.
Yeah.
Um, do you want to jump into some of the good things? I think we've been sort of uh, swimming in
Yeah.
this very general space, but we have some good things that we'd like to pay mind to.
Yeah, I think it's worth mentioning some more. So we already talked a bit about the precision medicine part where you're having solutions which are targeting people on a genetic level, and diagnostics and predictions that goes into that sort of decision support area where there's huge data sets on patients which are being analyzed by the AI and recognizing where uh, the most appropriate treatment should be conducted and why. That's also an important part, especially if you want that behavior change of the clinician to respond to the decision support tool, is that it's recommending something and showing it's working out. Why are you recommending that I give this treatment to this patient? Why are you suggesting I do this investigation, so on and so forth? I think the area that is also particularly exciting is operational efficiency. So there's a couple of aspects to this. One that has been around not that long, to be fair, is just the whole concept of being able to literally have a computer read the room, read the layout of a space, like the waiting room, look at the beds that's currently being occupied in the emergency department, and with an understanding as well of what conditions people currently being seen have got, and those it could suggest could be wrong. Like, it's kind of obvious what's going on with someone if there's a knife in their back, and what sort of help that they would need, generally speaking. So the AI being able to use computer vision to see what's going on, to be able to use natural language processing or any other audio input to assess what's going on with maybe the mood of people, reading their faces to see what's going on with pain, mood, consciousness level, if people are even still alive. You can use computer vision to even detect blood pressure now. It's quite powerful. You have to get quite close, but still, the fact that we can have AI that can make these assessments of what's going on in the emergency department to be like, actually, we need more clinicians here. Specifically, we need more doctors, or we need more nurses, or we need to get the crash team to come because someone's deteriorating. It's making those assessments. So there's that part of it where we are still using all these other sensors to pick up data. So cameras, microphones. But the other exciting part of AI is just looking at, as mentioned before, those massive data sets of a whole population to be like, okay, we've looked at all people that have got a particular disease, they're suffering from a particular skin cancer, and we already know what could be making people more, um, um, susceptible to cancer. The fact that it's exposed skin, you're not using sunblock, more prevalence in older age, things like that. But is there something else about what these people eat? Is there something else about their genetics? Is there something else about the environment that they're in, or where they've been before coming to this new environment, that is making them more likely to this disease or more susceptible to it, or even they are benefiting from treatment better than other patients? And it's this contrast to precision medicine where we're not just looking now at individual health, we're looking at a population level. This I feel is not being done enough. It's been done in academia, but academia is only of benefit if it then goes out into business or is used by the governments around the world. And that's something I've noticed even from my own research that I've done, looking at sickle cell disease and how we can improve the outcomes patients have when they go to the emergency department. So much of it has been done in the academic world until it actually becomes something that is a product or a new way of working in hospitals. The academic research is useless. And so that's what I find is a slight downside to what's going on with a lot of the research opportunities with AI, is that it's purely academic research. It hasn't gone into industry, it's not become a business endeavor. But there's opportunity here because the fact that the academic research has got all these wonderful publications coming out means there's opportunity for great good that we can be doing. I think the other thing that comes to mind before moving on would be its opportunity in medical research and drug discovery, which is an opportunity for there to be some commercialization. So, big pharmaceutical companies, they're using AI to run a variety of computations to see, well, actually, which structure of this drug will now hopefully fit this particular structure in the body, whatever protein, whatever it's trying to attack, specific pathogen, or it's interacting with another drug to be able to bind it so that if someone was to overdose, it can reverse it. But we're using AI to make that judgment call before the drugs are being made. This can save huge amounts of money, crucially huge amounts of time, which then in turn, if everything lines up, can save a huge amount of lives as well. So yeah, there's great opportunity for AI, and it's exciting to see that investment is going towards those sorts of solutions, because particularly with drug discovery, with decision support, the focus is less so on patients as a direct consumer out of pocket kind of cost in an unregulated way. This is a very regulated way where clinicians have to be involved. Clinicians may well be the users of the solution, and they're going to work it into their workflows to improve health outcomes of everyone that they then interact with.
Yeah, that very excellent point. Very rich. I want to complement that by saying, um, there are there's this idea of human centered design,
Mm-hmm.
where you deliberately look at an individual's needs, wants, friction points, pain points, whatever jobs to be done, and you engineer a solution that resolves and enhances the experience for an individual to maximize the functional benefit of engaging in a particular transformation. If you go to the doctor, instead of waiting 30 minutes, asking the receptionist chewing bubble gum and scratching their hair, fill this out, this paper form, wait 30 minutes. We're late because we have a backlog of patients. We'll get to you when we get to you. Rather than having that sort of negative experience, we need to acknowledge that humans are multisensory, organic, biological, computational devices. We ourselves are incredibly rich in our capability of detecting things through smell, through sight, through auditory, even, you know, taste and touch. Like, we are able to diagnose things that a computer can't process at the
Mm-hmm.
rate that we can process it. Especially if you have a specialization and you've looked at 100,000 patients in the last 10 years of a particular set of diseases or malfunctions, you
Mm-hmm.
are going to be really good when somebody walks into the room and you see somebody's shoulder drooping that way. Oh, skeletal, muscular malfeasance or whatever. I'm just making words, but you're like, you know what? Pinched nerve, car accident. Here's your remediation, physical therapy. Get out
Mm-hmm.
of. But on the other hand, we have computers that are infinitely better at aggregating data and processing that data mathematically.
Mm-hmm.
Um, so pattern recognition, statistical measurements, and insights. That's the domain of computation power. How awesome would it be if, rather than waiting on a human assisted experience for you to get your blood pressure checked, your weight checked, your height checked. If you walk into your room, as you said, Giles, and all those measurements are automatically collected,
Yeah.
uh, your patient records are pulled up in a queue, and when you view the doctor, they already know what was the last conversation you had because
Mm-hmm.
the doctor notes are digitized. They have all your current biometric markers, and you've predetermined through some interface, hey, I need help with this. I'm still struggling with this, or this has been
Mm-hmm.
resolved. So if we were to look at how to blend the strengths of a deterministic system that is based on experiential practice, the human, and pattern recognition system that is used to process signals in large quantities for a global population, and for 1 to 2 dimensional data analysis in very precise ways, computers, then we have a very efficient way of processing the healthcare experience. Cycle time is what it's all about, right? I mean, if
Mm.
you efficiently gather the data and you can evaluate the data based in the larger context of things, you can make a more predictive, you can make a more accurate diagnosis. Hence, you would enhance the overall experience, efficacy, cost factor involved with healthcare. But
Yeah,
um, I digress. Let's go into the bad because I want to talk about the bad. We need contrast, sweet and
yeah.
salty.
So we've already touched upon this a little, the fact that it can seem like an easier way to make a quick buck if you create a digital solution that is not regulated. Because the process of being regulated is quite expensive and time consuming. And depending on which part of the world that you're in or where you want to operate your product in, there could be different regulatory bodies that you're having to appease at the same time. You mentioned about how race and ethnicity can come into play, and definitely um, the racial bias that's been introduced in AI has been discussed a lot in general. I think what's worth highlighting that is, as much as we know that there is a correlation between racial bias and institutionalized racism, so racism that is just embedded within an organization, it's important to appreciate that this can happen in both a conscious and an unconscious way. So, just like people can be consciously racist, but also consciously competent, like you have to think about what you're doing. You can be unconsciously racist, just like you can be unconsciously competent. Like you don't think about it, but you're just able to just type very well because you can touch type. You could just not even think about it, but have thoughts, feelings, belief systems that are considered racist. Now, the thing about racism is that ultimately is the manifestation of thoughts or feelings, and then that discriminates somebody. Having those thoughts in itself isn't necessarily the problem. Like if someone doesn't like someone for whatever reason, that in itself, that's their choice, that's their preference. It's when it means that you're then harming somebody in some way, you're taking away their rights and the like, that's when it's harmful. Just like with sexism, any type of ism, any type of discrimination where someone is being denied what they deserve. And this is where it can happen in an unconscious way. So no one is deliberately creating, or we would hope, no one's deliberately creating an AI solution that's going to victimize someone because of the color of their skin or their gender or their religion or anything else that could be used to other somebody. But if it's not considering how these variables of the human condition affect someone's health outcomes, then that's a discrimination. So let's give an example of what this looks like. Most people would have been familiar with a pulse oximeter. This is a device that uses infrared technology to read the oxygen concentration in your blood. And I've seen it on myself. I've seen it on my wife because she's anemic. Chronically, it's a normal level of anemia for her, though her body's adapted. But you will use these pulse oximeters, and the readings that you get can be wildly off. They can be wildly off because someone's feeling very cold, so there's not as much blood flow. That can happen to anybody, regardless of who they are, what makes them unique. But there's something about having slightly darker fingers that can suddenly mean that you get an inaccurate reading. I've even seen this literally with the sensors for automated, non-touch soap dispensers or taps in public toilets, that it wouldn't fully recognize my hand unless I show it with my palm instead of the back of my hand. And I don't think anybody who was creating this solution was like, well, we only have a solution that's going to work for people who've got paler skin. I don't think that was the intention. But the fact that it wasn't tested to really make sure that it's going to work with people of any skin type is where the problem was. And The one of the big reasons why that would happen is if everybody that's involved with making the solution is perhaps of a paler skin tone. You see this manifestation in digital solutions in general, not just in digital health, where generally speaking, the use of a mobile phone, less so these days, because my daughter is nearly 3, is very good at picking up a phone and just creating chaos, but somewhat intentionally. She kind of just figures out how to use it. But generally speaking, a lot of IT solutions, if you're not familiar with using it already, you're going to struggle. And the reason being is that the people who make this technology are normally really, really, really competent with computers. Like if you're a software developer, you are by definition a maths genius. We're not talking about Tony Stark, Iron Man level, intellect to allow you to be able to go in time as the Marvel universe has shown. But we're talking about people who are really, really smart, making technology that's best used by people who also are at least very confident with technology, if not very smart themselves. And the whole concept of intellect, you don't want to get too complicated with that. But the point is here that if most people aren't confident with this technology, aren't so adept at using something, the people who are being left behind are those that are not representative to those who make the solutions. This is one of the reasons why it's important to have diverse makeup of people working on solutions, and it doesn't just mean ethnicity. That's just part of it. Age is a big part of why we're missing out on having solutions that really work for people. So when we look at racial bias, it's just one manifestation of there not being that diversity of thought and experience that can shape solutions that really work. And so I look at my training when I did psychiatry. It's normal in some communities to be afraid of ghosts. And in other communities, if someone was to say that they are seeing ghosts right now, you know that they are having a psychiatric breakdown. That you know it because of something else about them. And this is where AI can make mistakes, because if it only sees things through the lens of a particular ethnicity or a particular gender or a particular religion to make its assessments, it's going to mess up. And it's important that we keep in mind that we don't just focus on the race aspect of that, because race isn't the only thing that makes people different. But that's a particular bad of AI that comes to mind, is this ignorance that a lot of us can have of how deep rooted unconscious beliefs and truths can have that can lead to discrimination that's not intentional. Like we don't want to be harming other people. But if your belief system is never challenged because you're only speaking with people who think and act like you, how would you ever know that there is a form of discrimination going on with the technology? That's why testing is useful, but you don't have to wait till the product's gone to market and then everyone's like, actually, I don't think it's quite right to have this image talking about black people being the main natives of North America, like, or that there was white slaves in the transatlantic slave trade. Like images showing that just seems it's wrong because it's dismissive of truth. But the data set that was being used to train it and some rules given to it just wasn't really thought through because of the thinking of the people involved with it. So, and when that manifests in healthcare, where data sets are not appreciating where race, gender, sexuality, religion, whatever else is coming into play, it's going to lead, and it has already, lead to harm to patients.
Yeah, I want to unpack that. Mathematics is a pure implementation of logic.
Yes.
2 plus 2 equals 4. If you make an assertion, the sun beams light on a surface, the
Mm-hmm.
photons emitting from the sun hit the surface, it excites the local molecules,
Mm-hmm.
temperature rises. Cool. If we look at the physics of things, darker skin tones and lighter skin tones absorb light differently. And in the same fashion that it absorbs light differently, it also bounces light in a different manner. So, what you're saying, misdiagnosis through a medical instrument that was probably built by and used by predominantly a particular skin type, be it purple, be it green or orange, who cares? The
Yeah.
point is, if you're only calibrating the instrument to a particular pigment of color
Hmm.
and you do not account for data sets that have a range in the complete spectrum of the human experience, that's where we go into unconscious bias or
Hmm.
unintentional. Racism is a very strong word that sometimes makes people afraid or
Hmm.
angry or defensive, but really, racism really is supposed to represent unintentional harm.
Hmm.
Someone, you know, I would hate to go to a racist doctor, uh, s- but what we're looking at is more the incompetency or the psychological or circumstantial factors that are going to have a negative outcome in treating somebody that requires a very specialized kind of diagnosis. Um, Damn, I kind of tied myself up in some of those thoughts.
But
But
one thing I wanted to pick up on what you said, because sometimes it's manifested through racist ideas, racist beliefs. Like, so there's this statistic where black women are 4 to 5 times more likely to die associated with childbirth than white women, and that statistic dramatically reduces down and normalizes normally to just a one-to-one relationship um, when those patients, black patients, are treated by black physicians, which isn't always going to be possible. In some parts of the world, that's just the norm, and in some parts of the world, it's going to be more likely. So certain communities in across Europe or North America and the like. But generally speaking, the reason why that's manifesting is this whole concept of institutionalized racism and the unconscious racist beliefs that people have. So it can be, for example, the assumption that if this all women tend to have pain during childbirth, so when the black woman is saying that they're in pain, it's just the same as the white woman saying they're in pain. But what if actually the pain is associated with a complication in the pregnancy and they're bleeding? But bleeding can happen in pregnancy, like what can happen with a white woman and with a black woman. But it's this assumption that maybe what's happening with the black woman might be less serious than what's happening with the white woman because they can have a higher pain threshold, or maybe they're known to just complain a bit more, which is a racist stereotype associated with black women. But that's how people have learned to interact with black women, either from their own experience, because that's the truth. Your own experience can tell you that a certain population is a certain way, positive or negative. But a lot of times this could be taught to you directly. Like you're
right,
told, I remember as a doctor, that we would learn through, in medical school rather, we're taught through problem-based learning. So they give you a scenario and it's to allow you to learn about disease. The scenario will start, this South Asian or Bangladeshi man is complaining of cough. Instantly, this man must have tuberculosis. Why? Not because of the cough, because cough could be a whole lot of different diseases, but because they said it's from Bangladesh. Now, I was born and raised in an area called Tower Hamlets, a borough within East London. One third of the population is probably a bit more now, more like 40% of the population is from Bangladesh. And TB is actually very prevalent there. And it's more prevalent in people from Bangladesh. And that's what they were trying to teach me, that pattern recognition, but it was a racist way of teaching.
yeah,
Let's be honest.
it was a prepackaged bias. They
Yeah.
didn't give you the broader context as to the reasoning behind people
Yes.
from countries like these have medical programs or health or global population programs that do not effectively treat this kind of disease. Therefore, you may encounter higher frequency of these cases with this
Yes.
kind of race. That's perfect. That sounds great. Now I'm looking out for other diseases that may affect different populations more prominently because of cultural, environmental, economic
Yes.
factors. That sounds great, but what you're
There's a
saying that
there's a downside.
that reduction
Yes.
is biased.
That is the problem. Is where then there isn't the application of critical thinking, because that's normally why unconscious bias is harmful. Is that there isn't critical thinking. No one's like, okay, this black woman continues to complain of pain in the context of being pregnant, like how a white woman does. Maybe I should gather data points and not just assume what could be going on, actually gather evidence to confirm or deny that there is a problem. Because then, in there's evidence to say, actually, your treatment is working, it's now just time, or there isn't a problem with this patient, they're just more sensitive to pain and maybe give them some more pain relief. Then you have a different conversation with that patient. But unfortunately, there isn't the critical thinking pieces. They end with the thought process that's involved with that unconscious bias. So I could have a patient and they say, "Oh, I'm complaining of headaches. I'm sometimes wanting to vomit, and sometimes I'm a bit sensitive to the light." But this is an older woman who also says that they've now been feeling more pain in their chest, and I'm just staying fixated on this headache, which might be the sign of migraine, and ignoring the fact that the chest pain in context could also be what's causing all of these symptoms, and the person is complaining of having a heart attack. So I'm thinking of treating migraine because migraine is more common in women and heart attacks tend to be more common in men. So already there can be that bias associated with training with the patient, which you hope is overcome by experience and critical thinking to be like, well, let's cast the net further. Let's look at all the data points. Let's really understand what's going on. But that's where there is the sad part of unconscious bias being embedded into the way that people work, not the way that they think. If the policy that they have to follow, the instruction set that they have to follow, the rules that the AI was trained on, the data set that the AI was trained on, that it only follows, is in itself, not correct, not right. It's biased in some way. Then, even if someone was to apply critical thinking, they may still do something wrong because they're already following instruction, they're already following the rules at play. And again, if you're dealing with people who they're not taught, they're not encouraged even to think critically, they just play by the so-called rules, these unconscious biases are never checked. So we have to find ways ultimately to overcome these issues by designing the technology better, by giving it the better data sets, but also giving people ways of working that can overcome this unconscious bias. An example I'll give is something I've done through my own academic research. I was looking at people with sickle cell anemia, and the worst case scenario is you have an actually consciously racist white doctor seeing a black patient with sickle cell anemia who doesn't care about their health, doesn't because they're black. This can happen. It's not common, if I'm honest, as a black man worked as a doctor, that's not common. But that's the worst case scenario, is if they want to be vindictive, they want to be harmful. What's more common is that they could have unconsciously biased thoughts. They could have racist ideas that this black patient is maybe a bit lazy and maybe a drug addict while they're asking for this strong opioid pain relief. But if the rules is you treat this patient with IV fluids, you give them morphine when they need it because they've got sickle cell, and this is instructions that's been given by the hematologist that normally sees them, their racist doctor will follow the rules. The only reason they wouldn't is because they are deliberately trying to harm their patient. That's a criminal now, in effect, because they're abusing their position. And this is something I think we need to keep in mind when we're designing digital solutions in general, but definitely with AI. Where's that opportunity for there to be rules that says, okay, this is what you have to do, or processes that encourages critical thinking, where there has to be the application of other data points being used in the process of deciding what to do next. And I don't hear enough about that being part of what's being done with AI. and in digital health in general. But that's definitely one of my missions, one of the goals I try to achieve with the projects I work on.
What one very goofy example that suspends or the reality that we live in, and that I like to go into just to make it even
Mm,
more distinctive is, what if we're two green aliens from planet Bleep Larp, and we have advanced AI technologies and we have advanced data sets on our own population, but we want to bring this technology to planet Earth, and we want to install it in Colombia, in New York, in China, and Nigeria, and we simultaneously leave this device that is going to attend to them. Would we make it based on our genetic makeup, or would we want to collect and monitor the local populations to
mm,
provide data set population reflective treatment? I
mm.
mean, it would stand to reason our mathematics would only take us as far into our own biology, but if we want to effectively treat individuals in a local population, the data sets and the solution needs to be tailored to their needs.
Yeah. This is what is really supposed to be the crux of machine learning and not just the concept of artificial intelligence. Because when people talk about AI, you break down the word, it's artificial intelligence, it's not real intelligence, it's trying to make sense out of stuff. The real power is the computational work going on and the learning that happens. That's what's so powerful about what people are normally talking about with AI. Really, a lot of times when they're saying AI, it's machine learning. And that's what overcomes the issue because machine learning is the computer science equivalent of critical thinking that humans do. It is looking at all these other data points to try and understand what's going on, to then make sure that the next time it's exposed to a situation, or even the first time it's exposed to a situation, the best conclusion can be drawn from it.
Uh, as we're drawing near the end of this first episode, I want to
Mhm.
just wrap up with the outcomes that we would like to accomplish with this podcast
Yeah.
series. Um, we have to safeguard even the best of our intentions when developing and deploying AI systems in healthcare. And we have to enable conversations like these to be candid
Hmm.
and removed from emotion. I know we may feel a certain way when we hear different words that have
Hmm.
different connotation and context and emotional charge, but for us to really produce a biased, free, inclusive, explainable, traceable solution, we can only do that through candid, open-minded conversations.
Yeah.
Um, So, with that, we're going to be inviting a host of different people that specialize in healthcare and AI, and they are applying their computational skill set. Some have medical backgrounds, some don't, into various human in control, not human in the loop, human in control, human in the center, human centered design solutions, because we want to enable more conversations like these to take place in an open-minded fashion.
Yeah. I'm really excited about the guests that we've got lined up. We won't spoil any surprises at the end of this episode, but it's great to just learn from the experiences that others have around the world, which is also an exciting part. And yeah, we're grateful that you've joined us for this first episode. And any comments, any feedback that you want to offer to us, please. We're here to learn. We've got critical thinking hats on, but we're also here to learn, just like the AI is supposed to be learning. We as humans are learning and growing as well. So thank you for joining us.
We have one shout out from Maestro. He's saying, shout out to the first episode of the podcast. Thank you,
Hi.
Maestro.
Hi.
Appreciate you. And yeah, we hope you enjoy this recording wherever it's distributed. Stay tuned.
Take care now. Bye for now.